So go ahead, Dr. Pickett.
I certainly can. Thank you, Judge, Mayor, City Council members, and Commissioners. And I am, as you know, standing in for Dr. Escott today. So let me go ahead and not stand on ceremony and get with the update here. This is what our little graph showing some progress towards herd immunity within Austin Travis County. So here we have in yellow there are confirmed cases, and then our additional confirmed cases of 12% for a total of 18%. Happy to report that 43% of our community is fully vaccinated with both doses for those who took the 2-dose vaccines, and then another 13% being at least partially vaccinated, having had at least 1 dose of the vaccine. So this leaves about a quarter of our community who are still vulnerable to COVID-19. Now, this is assuming that there is little overlap between those who have had confirmed COVID-19 and those who have been vaccinated. So that 26% number may be a little bit larger. The takeaway from here is that COVID-19 is still with us, and it is still in our community. There's still a lot of people who are vulnerable, and it can still readily spread in our community, and we need to keep remaining vigilant in our distancing and our protective measures. However, we do have still good reason for being proud of the work that everybody has done in helping to slow the spread of this disease. Here we have our new confirmed cases. There's a little drop off there because we are no longer reporting these numbers on the weekend. So the weekend numbers will be reported on Monday. Here looking at our new admissions, we're still seeing this oscillating, a little bit of up and down movement here. So we're not seeing large substantial change within our new admissions within the metropolitan statistical area. So we've taken to filtering our moving average of admissions to help us to understand what is our community and also those who are admitted within our community but are not Austin Travis County MSA residents. So when we filter those out, we find that our moving average of admissions is 13.85. We are still firmly within stage 2 of our risk-based guidelines. The current hospitalizations, ICU admissions, and ventilator use. Again, you can see that there is some oscillation in the hospitalizations, but no large changes over the past couple of weeks. And same with the ventilators and ICU usage. Here we've got our count of hospitalizations by age group, so you'll notice a little uptick in hospitalizations among those 70 to 79, as well as those 40 to 49, and a bump also in our 20 to 29 age group. I'll get to that in a moment as well. And here we have our count of hospitalizations by race and ethnicity. Green represent our Latino population, blue is our white non-Hispanic, and gray is our Black and non-Hispanic there. Orange, Asian non-Hispanic, representing a fairly small number there, and our American Indian, Alaska Native in blue, and then others in yellow. So our positivity by week has continued to go down for the last several weeks. This is good news. We're currently at 2.5% overall positivity. And as I get to this next slide here, for the first time since the start of the pandemic, all race and ethnicities are below the 5% positivity rate. So again, this is good news for us. Here are with our age groups. The thing to take away from this is that the 20 to 29 age group represents the highest positivity rate among all of our age groups. This is, of course, of concern to us as this is our such a large portion of our workforce and a large portion of folks who are out and about within the community interacting with each other. And this is our positivity rate in school-aged children, again below 5%, which is great. High schoolers are representing the highest positivity rate, but our middle school and elementary school and preschool following behind them significantly. So here's our long-term care facility weekly dashboard, and this rate continues to go down, which is great news. This large vaccination effort that we've had within the nursing facilities has done quite a bit to protect our nursing home population, to protect our elderly, and as such, to get them a little more freedom with visitation. And so, as you can see, those graphs in the center of the screen there, the green and the purple, these cases are pretty flat since starting that vaccination effort at the beginning of the year. So the COVID-19 variants, these are the variants of concerns that originated in the UK, Brazil, South Africa, etc. We are not seeing a whole lot of variants of concern here within our community currently. These variants are concerning to us because they do show a penchant for reinfection. And so for those patients who have already been infected by COVID-19, the variants can evade some of that natural immunity. The vaccines, however, the Moderna and the Pfizer, have been shown to be very effective against these variants. So still getting good protection from the vaccines. The Johnson & Johnson vaccine as well has been shown to be pretty effective against the variations or the variants. So COVID-19 breakthrough and reinfection. So breakthrough are those who are fully vaccinated and yet can end up contracting COVID-19 anyway. And then the reinfections are those who've had COVID-19, who had confirmed COVID-19, who then become infected again. The breakthrough infections, what we're showing here in our community is that we've had 0.02% breakthrough rate for those who are fully vaccinated. So this is showing that the vaccines are really just incredibly effective at preventing infection. We've had 7 hospitalizations, all of whom were over the age of 50, and only 2 deaths, all of whom were over the age of 70, or both of whom were over the age of 70. Reinfections, we've had 362 potential reinfections, and we're still investigating those cases as well, but this shows that there's a 0.43% rate. So the rate of infection is 20 times higher if you've had natural infection versus if you've been vaccinated. 44 hospitalizations and 4 deaths among that reinfection group. The take home is that even if you've had COVID-19 infection, really do need to be vaccinated. It provides much better protection against the variants and infection overall. So here we are at stage 2, and this is these are risk-based guidelines. If you are fully vaccinated, then you can gather for indoor groups or outdoor private gatherings without masks, going out dining and shopping without masks. Still, for travel or gathering in very large groups, attending events, masks are still recommended whether you are vaccinated or not. For those who are partially vaccinated or unvaccinated, we do recommend masks for gatherings, for private gatherings, for travel, for going out and dining and shopping. So these recommendations are, again, fully vaccinated. You can participate in gatherings, you can dine, you can shop without protections or without precautions if allowed by the business. Of course, businesses have the right to set those conditions within their own walls. If you're partially vaccinated or unvaccinated, we do recommend that you take precautions, including masking and distancing. Regardless of your vaccination status, travel, especially on public transportation, with precautions. With that, I will take any questions that you have.
Thanks, Dr. Pickett. We'll turn it over to Interim Director Adrian Stirrup, and then something new for this week, we're going to have a short briefing from Constable Morales and Chief Bailey and Chuck Brotherton on the county's efforts. But we'll turn it over for now to Interim Director Adrian Stirrup.
Thanks, Dr. Pickett. We'll turn it over to Interim Director Adrian Stirrup. And then something new for this week, we're going to have a short briefing from Constable Morales and Chief Bailey and Chuck Brotherton on the county's efforts. But we'll turn it over for now to Director Thank you, Judge Brown. Dr. Pickett, if you think you would do the honors. So first of all, just to share the updates for vaccines in our community. A reminder, this is community care and APH data combined. And so we are at a total of 422,422 vaccines for our community. The week ending May 22nd, we delivered 9,876 vaccines. If you visit the dashboard, you can hover over the pie charts at the bottom to see where we're doing in terms of our demographics. And we have made some incremental improvements in our communities of color. As of right now, 35% of the vaccinations delivered were in the Hispanic population, 7% Black, and 6% Asian. And so we will continue in our community and place-based efforts to help those numbers improve even more. Next slide, please. According to DSHS vaccine report in Travis County by age, you can see that our 12 and up, we have about 64% have at least one dose, with 51% fully vaccinated. At our last session, there was some interest in the number of children that were vaccinated, and that report shows that we have over 13,000 children in Travis County between the ages of 12 and 15 who have received at least one dose of the vaccine. For our 65 and up population, we're at 85% with at least one dose and 73% fully vaccinated. Again, here's the maps of our clinics. Delco Center will be demobilizing this week, but we will still have Little Walnut Creek Library, Southeast Library, and the Anna Lark Center, which is in East Austin, has flipped from a testing site to a vaccine location. Also, it's prudent for us to give a testing update as we begin to stand down some of our community-based testing options. We still will have our public drive-through testing at St. John's. And we still will offer in-home testing. Residents can call the number listed there to set those up. But with the availability of testing at local pharmacies and clinics, we feel at this time that it's okay for us to roll that back. As we shift more into our role as a safety net provider, we are in conversations about adding testing to our mobile van programs. If you're aware, right now we do HIV, STI screenings, and we also do blood pressure and glucose checks. And so there is a possibility that we could add COVID-19 testing to those mobile operations in the future. Next slide, please. Oh, well, that's all that we have for today. We will kindly take any questions.
Awesome, thank you. And Constable Morales and Chuck Brotherton, are y'all on here?
I'm here.
Judge, I am here, and Constable Morales and Chief Ken Bailey are here as well. And before we get to their updates regarding our strike teams, I just wanted to give you, Judge, Commissioners, Mayor, and Council, a very brief update on the Travis County, the Central Texas counties vaccine collaborative efforts, our continuing mass vaccination efforts. We did about 10 weekends at Circuit of the Americas with a very successful mass drive-through vaccination campaign. We transitioned 3 weekends ago from TOTA just because as that demand and the thousands a day vaccines that we were doing began to taper off, we recognized that we needed to get away from that large site to a smaller footprint. And we selected the Travis County Exposition Center on Decker Lane. And we have been there for the past 3 weekends. We'll be there this weekend. We will be beginning to plan how to scale that effort down as the drive-through demand again continues tapering off, and we ramp up to more of a strike team effort, getting out into the community, into churches, schools, and other neighborhood settings where we expect to see ongoing demand. So this past weekend at Expo, we did a total of 160 on Friday, 335 on Saturday, and 219 on Sunday. Those were first doses delivered at Expo. We will get to second doses We did our last round of second doses on Sunday at Expo. Those were second doses that were holdovers from CODA. So we get to second doses at Expo starting not this coming weekend, but the weekend after. But again, we expect that demand to continue shrinking as people take advantage of opportunities to come to vaccination centers in their communities closer to where they live. So with that, I will turn it over to Chief Ken Bailey with Travis County Emergency Services District 11, and he will present about, Constable Morales will talk about our strike team. So Chief Bailey.
Good morning. Thank you, Judge, County Commissioners, Mayor, City Council members. My name is Ken Bailey with the Travis County Fire Rescue ESD 11, with Constable Morales. I'm going to share my screen. I'm assuming everybody can see that. Our effort was a joint effort between several counties: Hays County, Caldwell County, Bastrop County, Travis County. This is specific to Travis County. We've had 2 vaccinators of record for the collaborative. Community care was the largest one, providing the bulk of the work at CODA. We also started, as that started to scale down, we recognized the need to address some vaccine hesitancy issues and moving into the community to make it easier for people that were unable to seek the vaccine at a large site. We were focusing on the Eastern Crescent, and what that work produced was 24 different locations where we were providing vaccine to the community. Collectively 84,000 vaccines delivered, and creating a number of partnerships, 18 plus and growing. One of our goals was to remove obstacles, optimize the flow of vaccine into the community, and then create and leverage partnerships. We now have a partnership with Austin Public Health. We have a partnership with Dr. Karen Smith and Manor, which was a very big thing for us, and then the Austin community and a number of other people. To give you some sense of what was delivered, we've taken the vaccine and recognized that over 50% of our vaccine, the collaborative effort, at least relative to Travis County, was done in the Eastern Crescent. Constable Morales is going to talk a little bit about our outreach that was beyond the mass vaccination side.
Good morning, Council, Commissioners, Judge, and Mayor. Our mobile vaccine collaborative offered a barrier-free vaccine distribution throughout the Eastern Crescent. We focused on communities that do not have means of transportation or access to technology. One of our main shots was bringing the shots into the community. I'm sorry, our main goal was bringing the shots into the community. By utilizing the groups that were already existing, our community groups, our association, our neighborhood, and how we accomplished that was, using people that had familiar faces and are trusted people in the community. Our target areas were those of that we followed with the census, the undercounted and the hard to count, hard to reach people. And again, the best way to do that was going out within our community, finding people who were trusted, and kind of educating people about the vaccine and how we can get it to them and areas that were hard to reach. I say this all the time. This is an effort with other agencies. We don't do this by ourselves. I say that's in Seton, community care, the city of Austin, our council members, our commissioners, our judge, ESD 11, going out there and actually reaching our community and making them feel comfortable. Now, I explained this a little bit before, that it's the education part and the community outreach and the one-on-one. It's very important. And by doing so, we can make our city a lot safer and save more lives. So the effort with the mobile vaccine is simple. We know there's working families that work till 5:30, and rather than take a day off for the vaccine, we give the shot after 5:30, and we'll run till 10 o'clock at night if we have to. Those that they can help and bring their children on Saturdays because of school, and now the school's coming to an end, we want to make sure our children are safe, especially for the summertime. And we want to make sure that people go back to some somewhat normal lifestyle. But that's the goal of the mobile vaccine and our strike team. Chief.
Thanks.
So to give you some idea of the proportion of vaccine given within the community, Dr. Karen Smith, Mayor Wallace of Manor, partnered with us and delivered a large number of vaccines into the Manor area. Of course, Del Valley and Dove Springs is another focus of ours as well. And to give you some idea of the breakdown of by race, because of the way that we report to the state, you'll see on the race is 54% white, but 77% of that 54% are of Hispanic ethnicity. And then the age group is interesting. I was looking through the numbers last night, and about 1/3 of the recent, probably last month of the vaccinations have been going to kids under 18. We've seen a large interest from the school districts. And then the last thing before, be happy to answer any questions. Travis County and Chuck Brotherton has provided a lot of leadership in holding the group together, support through the mayor's office, the judge's office. Commissioner Gomez has been instrumental in supporting us. This is not the George and Ken show. This is a lot of players coming together. Seton has played a huge role in this. Community care has just crushed it with helping in every way that they possibly can and removing all the obstacles. And now I think that the struggle for us going forward. Oh, and I do want to mention Councilmember Casar and Councilmember Fuentes has also been instrumental in driving some of these community efforts with us so that we can get in there, and they've been trusted voices allowing us to deliver the vaccine in those areas of the community. And the challenge moving forward is the vaccine hesitancy, and the collaborative is actively working with APH and others to address that. Happy to answer any questions.
Thanks all very much. I will pass it on, or I guess I will start with the questions now, and we'll check in with Commissioner Gomez, see if you have any questions for Dr. Pickett or Director Stirrup or Constable or Chief.
I don't have any questions. I think that the reports are pretty clear. We're making some progress, looks like, and I think especially with the fact that the constable and the chief are going directly to people where they are with their needs and overcoming barriers to them getting the vaccine. And I think that has been very instrumental in trying to increase the numbers. And then forming those partnerships, those are really good, will produce good results. So I'm very proud of the team. Thanks so much for all that you have done to increase the number of people who are vaccinated. Thanks.
Thanks. Commissioner Shea?
Good morning, everyone. Nice to see you, Constable Morales and Chief Bailey. Thank you all for the work that you're doing in the community. One of the things I'm trying to get a better sense of is how, if there's a coordinated plan to reach the younger people as the vaccine is approved for, and more of the vaccines are approved for young people. School's ending, potentially summer camp is starting. Is there any kind of a strategic plan for a more coordinated outreach? It sounds like the drive-through is really kind of winding down. But if you could speak to that aspect of it, because it seems to me that's the largest sort of singular group. They're not singular, but specific group that may be unprotected, be most unprotected.
I can speak to that, Commissioner. We're working with our ISDs and Travis County and the city of Austin. Just recently, we did almost 500 shots at the elementary schools for children over 12 years of age. Also partnering with the city of Austin Parks and Recreation. for summer programs and events that are happening in the summer. We know that there's a lot of recidivism coming out for summer camps, and we want to make sure that we target and kind of educate some parents and kind of encourage the shot in those efforts there. We do have those events coming up in June. And even when school's out, we still have working with AISD and a couple other ISDs with parent support specialists to have pop-ups in their local community and schools.
Thank you.
Just a quick follow-up on that. Is somebody else going to address that to the extent that there are other follow-up? Thank you.
Yes. So as Mr. Brotherton mentioned, there is this Austin Travis County Vaccine Collaborative Group, and we are talking about doing more of what the constable just mentioned. We have polled the different ISDs, including charter schools in the area. We are, from an APH standpoint, we partnered out at CODA this weekend so we could get our vaccinators used to Pfizer. We've been working with Moderna. So as we're trained up, we will be able to add to those efforts. We have plans for our Shots for Tots clinic to offer the Pfizer vaccine as well. But, you know, with messaging of driving parents to wherever Pfizer is being offered, as well as supporting these community collaborations for pop-ups in different areas.
And Commissioner, just this past Saturday, the County Collaborative and Austin Public Health worked together to do 2 Del Valle ISD sites on Saturday. Austin Public Health was focusing on Del Valle High School, and the Collaborative was focusing on Daly Middle School. We provided Pfizer, the Collaborative provided Pfizer vaccine for both sites, and we did just over 650 doses on Saturday. And we will continue working with DVISD going forward on Saturdays. As long as there's demand, we will plan to be at both of those schools. Also, Dr. Escott and I have been meeting weekly with our ISD superintendents for the past year. And we have reached out to them to see who among them might like us to help organize some efforts in their schools. Pflugerville ISD has expressed interest, so we will be putting them in touch with our strike team coordinators to get an effort going in the Pflugerville ISD. So, yeah, we do continue working with the ISDs, and happy to organize strike teams anywhere that they might like us to.
Thanks. Commissioner Trevilian?
Well, first, I want to make sure that we commend staff again for reaching out into communities and working with neighborhoods and with people from the neighborhoods. I talk to Constable Morales fairly regularly about how we work together to address the needs in the Eastern Crescent, and just so I can. Shout out to a few people who are doing this work as well. He has worked directly with Constable Nixon. I think that the work that they've done together has been significant. Black Leadership Collective, as we've worked since the pandemic and through the storm, set up centers at Sims and the Millennium Center to provide a lot of resources for community. Dr. Jerica Hockaday has done a lot of work, not only in vaccinations, but in testing as well. The African American Heritage Council. The church community has been very active, particularly Greater Mount Zion and St. James and Mount Zion. I've had numerous community organizations that have gotten involved. Rudy Mateer, who's a council member out in Pflugerville, Mayor Wallace and his team, St. Mary's and Abundant Life churches in the Pflugerville area. So we see a lot of community people coming together and working together. We just have to make sure that as we build out our next iteration of strike teams, that they reflect all of the communities that have been underserved or have not gotten us to the point where we can achieve herd immunity. So just want to say how much I appreciate the efforts that have gone on in the field. The community groups that have been reached out to and have stepped up to work on these issues. And we want to make sure that we maintain this type of robust effort, certainly through Juneteenth, where we've got several activities planned. So thank you.
Just lots of gratitude for all the collaboration, and I don't have any questions.
Thanks. I think just one question for Constable or APH. If there's a community group that wants to host a vaccination or a company that wants y'all to come to their office or something like that, what's the best way for them to, who do they reach out to, or how do we make that happen?
I would suggest that they contact our Travis County Collaborative, and I don't have the information, but we do have that information that we can share with you. You know, I think it's very simple. Once we get contacted from a group or a company, we're ready to go. You know, our teams are hot.
Awesome. Thanks, Chuck. Sorry, go ahead, Adrienne.
Sorry, sir. I would add from the city side, the easiest way to get that is for someone to call 311, and then those operators will transfer to the appropriate person in Austin Public Health.
Terrific. And Chuck, is there a way for them to reach out to the collective effort? Is that?
I would offer that they can call me, of course. We are bringing in some additional capacity today at Commissioners Court voting session.
Okay.
We are asking for authorization to hire 3 additional people to work specifically on coordinating and outreach for our strike team efforts. So these 3 people would be assigned over at the Constable Precinct 4 headquarters with Constable Morales, working with the constable to reach out into the community, and also to be a point of contact for community leaders to reach back into us and get our strike team efforts scheduled. 311 can be a useful tool. There is a lot of good cooperation between county and city at this point. 311, the numbers actually don't, if you live outside of the city of Austin, they don't reach 311. So for folks in the county, the 10-digit number for contacting Austin 311 is 512-974-2000. And that can also, I would offer, be a useful clearinghouse for us to get information for folks who are looking for us to do strike teams.
Thanks. Sounds great. So yeah, if you have a group that needs vaccinations, sounds like 311, Constable Morales, my office, we'll figure it out and send the team there. Thanks all so much. Mayor, I will pass it on over to you.
Judge, thank you. Council colleagues, we're going to start with District 10 and then work our way back to the Mayor Pro Tem. So we'll begin today with Councilmember Alter.
Good morning. Can you hear me?
Yes.
Okay, great. Thank you. Well, thanks everyone for all of this really important work. It was great to hear from the new experts that we saw today for these meetings. I appreciate all the work that you're doing out in the community. I have a question for public health and maybe for the city manager's office. We've been hearing that our seniors who are now vaccinated, which is awesome, are trying to get out more, but the programs that are set up to help them need more drivers. So I know that Drive a Senior is in desperate need of more volunteer drivers. I know Meals on Wheels, although not driving people, needs drivers to help them deliver meals because a lot of people had stopped doing that during the pandemic. So I'm wondering if the seniors team can check in with those organizations and maybe the city can do some kind of PR assistance to that to help get the word out. We'll be including something in our newsletter, but I wanted to flag that. It's great that our seniors want to get out, but I think we do need to support those organizations with the volunteers because one can only imagine the higher level of demand that they're under right now that people are finally feeling a little bit more comfortable to either have someone come into their home or to go out. So I don't know if that's Ms. Stirrup or the city manager.
I can start. Just really appreciate you flagging this, council member, and we will certainly be talking to our team and the folks that work with the senior population within the city to not only raise that awareness, but see how we can have additional resources to support these efforts. ACM Hayden Howard, do you want to add anything?
Good morning, Stephanie Hayden Howard. We actually met with the some of the members from the Senior Commission on yesterday, and Austin Public Health has Tabitha Taylor, who is the coordinator at Austin Public Health. And so what we'll do is we'll collaborate with Tabitha to have her to collaborate with the various city departments that work with seniors in their capacity as well, and then get with our communications team across the service area, because I think that would be very helpful. And then we have those contacts at Meals on Wheels and Driver Senior and Family Elder Care. And so she can reach out to them and just kind of brainstorm how we could do some type of public relations type of campaign.
And then also, as we're thinking about our COVID dollars, I know that there's some potential, transportation investments that some of these organizations may need in order to be able to transport the seniors or to deliver the meals under kind of the new environment where people are still working at home more. So, as you're looking at the health dollars, et cetera, if we can explore that, that would be great.
Okay, we will.
Thank you.
Councilmember.
Sorry, Councilmember Tobo.
Thanks. I have two questions, but they're both super quick. On page 20, can you tell us, Dr. Pickett, what percentage of 12 to 15-year-olds 13,308 represents?
I'm afraid I cannot. I'd have to go back to get that number. I don't have that in front of
That'd
me.
be interesting to know in future. Of course, I hope that number will increase, but it would be interesting to know what percentage that is. And then with relationship to the slide 15, I hope I'm going to ask this correctly, but is the research suggesting any difference in terms of how individuals who have had COVID is there any difference in reinfection rate among those who have had COVID and been vaccinated versus those who have had COVID and have not been vaccinated? I think you addressed this, but I kind of missed it. I mean, you talked.
So for those who have been through the virus and had their vaccination, I do not have that data.
Okay, thanks.
Okay.
The upshot of that is I'm just wondering if people who have had COVID have higher levels of immunity with the vaccine or same level of immunity or less immunity. So anyway, it would be interesting to know if that's being studied anywhere.
That's a good question, Councilmember. I'm afraid I don't know that answer offhand.
Okay,
But
thanks
isn't
so
that the
much.
reinfection rate? That's not the reinfection rate?
I think the reinfection rate is not divided by those who have had vaccine. It's not broken down into those who have had the vaccine versus those who have not. That's my understanding of the info on
Well,
the
there's
slide.
a breakthrough in the reinfection slide on slide 15.
Yes, Councilmember, that reinfection rate is, Commissioner, that reinfection rate is those who've had the virus. That does not necessarily include those who have had the virus and been vaccinated. So, potentially have a double layer of protection.
Got it.
Also want to bring up, as we've been talking about vaccination of children, that Moderna released their stage 2 and 3 trial data on ages 12 to 17, and they found that it was safe and that they had no infections of COVID among kids who received the Moderna vaccine. We expect that FDA authorization for that age group will follow shortly.
Okay, thank you. Councilmember Ellis.
Thank you, Mayor. Dr. Pickett, can you go over some brief best recommendations for individuals who might travel? I know a lot of people have held off traveling for a very long time, and so now that people are feeling a little more comfortable with it, what is a best practice and what should we be doing if people are going to take trips?
Thank you, Councilmember. And that's a great question. First and foremost, wear a mask while traveling. It's impossible to avoid folks in those close confines of airplanes and the airport. So should wear a mask while traveling, frequently use hand sanitizer and wash hands, get distance from others as much as is possible. Of course, I'm sure we've all been through the airport and an airplane, and distance is one thing that's very hard to come by. But to as many layers of protection as possible. So the key, first and foremost, is wear that mask, wash your hands, sanitize your hands frequently. And when traveling in public transportation, such as buses, then those recommendations hold firm as well.
Thank you. I appreciate that. I know there are other things besides COVID that people had been transmitting to each other. Just as you cough, you sneeze, you're in enclosed environments. And so I appreciate that reminder just to continue being safe.
Okay. Councilmember Poole.
Thanks. And I just want to pass along my deep appreciation one more time to the team that's been battling COVID across Austin, Travis County. And also it feels like a bit of a breakthrough week, this report. And I mean breakthrough not in the COVID reinfection sense, but breakthrough in actual concrete progress being charted. I know we have all been urging and concerned that our East Side communities get inoculated, and it's been difficult to penetrate deeply into that community. But I think that the community-based, friendly, familiar face approach that has begun to take hold really is the way to go. And I'm glad to see that there is real progress being made. My goal, of course, is for everybody in our area, our region, our state to be inoculated. And I thank you all for the dedicated and persistent work that y'all are bringing to the effort. Thanks.
Thank you. Councilor Kelly.
Good morning, and thank you everyone for all the hard work that you're doing. I definitely appreciate it, and I know that our community does as well. I do not have any questions. Thanks.
Yeah, Councilor Kitchen.
Thank you. Just a quick question. Thank you all for all the work that you are doing. Vaccination is clearly important to reduce our risk and to reduce spread. I have a quick question related to the B16 Indian variants. My understanding is that it is spreading throughout the United States, and I have seen it recently reported in Dallas. So I'm also hearing that Pfizer announced that they have found that Pfizer is less effective against that variant. I think they mentioned 70 to 75%. Can you just speak to, I think I heard you say that we haven't seen that variant or other variants in our community yet. And could you just speak to what the thinking is to protect ourselves against that variant and the thinking, at least in our community, related to the vaccine's protectiveness against that variant in particular?
Thank you, Council Member. That's a great question. And we have not yet identified that variant in our community here, although it has been identified in Texas. And so it is likely a matter of time before it does make an appearance here. Although the vaccine, the Pfizer reports a little less effectiveness against that variant, the vaccine is still very effective against the variant. So first and foremost, vaccination is the best measure that one can take to protect oneself against this and the other COVID-19 variants. With regards to other protective measures, then the advice that we've given regarding COVID in general, with regards to masking and distancing and hand washing, still holds true here. I would caution anybody against drawing conclusions from the origin of the variant and any apparent ethnicity or race of someone. We certainly saw that with anti-Asian discrimination with folks with the virus being associated with China. We do not want to see that with any with any variant, it's specific measures for folks who are coming from different areas of the world or who have different ethnicities are not effective at preventing the spread and only increase division in the community.
Dr. Pickett, thank you for saying that. I apologize. I should not have used that moniker. It is the B16 variant, and so you are absolutely right. The origin is not relevant here, and so I will refer to it as the B16 in the future. So thank you for mentioning that. So one last question then. What about ventilation or airflow, perhaps might be a better word, is really critical, which I'm understanding is one of the reasons why we really don't need to be concerned if we're outside. Can you speak to the latest, thinking, at least in our community, that you're aware of regarding use of air purifiers and other things like that to assist with ventilation in our buildings as we start to go back to our more normal activities?
Thank you, Councilmember. That's another great question. And as often as you can turn over the air within a building, then that helps to reduce the amount of circulating virus that is hanging in the air. And with regards to use of air purifiers, I can't speak to the effectiveness of one method over another. I know that some have installed things like ultraviolet air purifiers or high efficiency filters and that sort of thing. I'm afraid I do not have data on the effectiveness of one method over another with preventing the spread of this particular virus.
Thank you, but I think you said that airflow is an important piece of it. Okay, thank you.
Yes, ma'am.
Okay, Councilmember Kassar.
First, I'd like to also add my thanks to the county collaborative team. I know it's not fully the Ken and George show, but thanks to both of you, and please send your thanks to everyone. Y'all can't hear me well?
It's just really quiet, so we can barely hear what you're saying.
I'll talk louder. Does that
better?
Okay. But thanks to Ken and George, and to send my thanks to the whole team there. At the last session, I had asked for maybe some demographic information similar to what you presented on the city side. So I'll submit that by email and see if maybe we can get that for the next presentation. But my question is more to where do we go from here? I understand we're demobilizing Delco soon, trying to work at this more neighborhood-based level. But how can the council and the community help? What is our path that we're thinking about for the next, several tens of thousands of these vaccinations? Can y'all lay out, whoever it is, probably people from multiple teams here, can y'all lay out to us your thinking, since we're starting to demobilize some sites? That probably means we're moving resources to other places. How can we help, and what should the community be expecting our strategy is to get to the next big chunk of vaccination, since we know we need more?
Well, I'll start and then allow my colleagues to jump in. I think the collaboration will continue, and that will be key to our efforts. It warmed my heart to hear what was going on with, the constable and the things that we're having in community, because each of us were playing our positions, but having a good collective effort. And so as APH shifts from being a hub provider, we too will join in those efforts to have those more community-based sites. We've already started a faith-based initiative in churches on the east side. We've been in Del Valley. We're partnering with the county out in Del Valley as well. And so it really will be using the community health worker model, not only to deliver vaccines, but to make sure that we are addressing the community's concerns about vaccines. Our messaging will be targeted and culturally relevant and specific, making sure that we're using language and imagery that resonates with the population that we're trying to reach. Central Health and Community Care have these forums every Tuesday night where they, on Facebook, where they address a certain section of the population. The mayor has been involved, and I have been a panelist on those. So it's really now, I keep telling people like the water weight is gone, right? We got those first pounds off easy. Now we've hit that wall where we really have to dig in and work for it. And so it will be those intense community-based efforts that will get us over the next hump. And I am excited that we have partners at the fray that we can continue to collaborate and make sure that we are complementing our efforts. And so that's what I have to say from APH standpoint. I invite my partners from the county to add to that.
Yeah, good morning. I think it's a great question, and I would agree with the previous comments. I think one of the things is the question of data, and APH, we recently in the collaborative, because of some of the meetings, found out that they are measuring the uptake or decline by zip code each week. And so we also have to recognize that the one message is not going to fit all. There's this movable middle and that's going to take gene for different verticals within that movable middle. But with the data that APH is collecting, we can see and test in various places to see what is more effective and then move our resources or adjust. But I think she hit the nail on the head. The water weight is gone, and this is tough. This is the hard part. But I think our partnership will help us push through that. Maybe not as quickly as we all want.
Okay. Councilmember Renteria.
Thank you, Mayor. My question is, do y'all have the data from of who's been taking the vaccine by zip code?
Yes, sir.
I don't know whoever wants to answer that.
So yes, sir, we do have that data available. I can send a breakdown to your office if you would like after this meeting.
Yeah, I would like to see that because I think that by looking at the zip code that, we might be able to concentrate more in that area to administer the vaccine there. And it would, so I would like to have that data. Thank you.
Would you go ahead and get that to all the council offices and also over to the county, so if they want to distribute it, they can as well. Thank you. Councilor Fuentes. Do we have Councilor Fuentes with us? I don't think so. Mayor Pro Tem.
Thank you, Mayor. I actually don't have any questions. I'll echo my colleagues' sentiments about appreciation for this effort. I guess I do, although it's not a question, I do continue to have some concerns about the number of people who are hesitant to receive the vaccine. And so my hope is that we eventually sort of get to the root of that hesitancy and encourage more people to pursue being inoculated.
Okay. Again, the theme of today's meeting, I think, might be the city-county collaboration, and that's just really good to see. And I know that everybody's working closely together to make sure that gaps are being met. I just want to thank everybody that's had a chance to speak. I was encouraged yesterday at the announcement that the soccer stadium could be at 100% capacity. Following whatever masking guidelines that the health authority suggests to them, and their intent to follow that guidance. Also, the foreshadowing by the county judge that the city and the county are going to work together to make sure that there's vaccinations available to ticket holders going to that game that might want to get vaccinated. And as the county judge and I and many others have discussed, building on that strategy as we have more and more larger events happening in the city, trying to provide those kind of pop-up opportunities at these events that are already gathering people is certainly something that I'd like. And finally, I just want to reiterate it. The request that Councilor Kassar made. The demographic information is good cumulative, but at this point, the last 2 or 3 weeks, 4 weeks aren't going to really be able to change cumulative demographic numbers just because the numbers are so large. And frankly, when we were starting out with vaccinations, the initial priority was to get as many people vaccinated as we could in age groups and otherwise in order to bring infectivity in the overall community. Now that we're doing more targeted efforts, the demographic information that the chief and the constable provided with respect to the activity over the last several weeks was really helpful to gauge whether the efforts we've been doing recently are actually hitting the vulnerable populations we're really trying to focus on. So Director Stirp, I think it would be really helpful if we had that same kind of more recent data for the larger public health system, community care in the county. So the more recent time would be information on demographics I'd like to see as well. Judge, I think that takes us through our entire group. So
Thanks, Mayor. Thanks everyone here, especially Chuck and Constable Morales and Chief Bailey for your report. First one this week, but I guess we'll keep doing that. And thanks APH and everyone on the call for the partnership and trying to keep improving things and keep getting more people vaccinated. I really appreciate that. Mayor, we will adjourn and come back at 10:10. So we'll adjourn for 10 minutes here. And thank you, Mayor and City Council, for joining today.
Thanks, everybody. Stay safe.
Judge, thank you here that on the 25th at what time is it? At 10 o'clock. This meeting will be adjourned. Colleagues, I urge you all check the message board. We're still talking about when we get together, whether there be a special call to discuss information related to spending plans, possibility of a meeting on Friday, checking now. If not, I anticipate having it as a discussion item next Tuesday and Thursday, and maybe not action until the following week. But please pay attention to the message board. Dependent really on the manager at this point. He's checking with staff to make sure that when we get together, it's actually a meaningful opportunity for us to do that. So check the message board. With that, we're adjourned. Judge, we'll get out of your hair and let you guys hold your meeting. Thank you.
Denying my body what it wants. How can I fulfill my flesh if I'm still drawing back? Carrying this temptation like Jesus. I'm too fond of apples. Yes, they brought about Snow White and mankind's demise. But I am living in a fairy tale. Roaring, biblical.